everyone, my name is Kara Busenhart. I'm project director for a clinical postdoc fellowship that we have for advanced practice nurses here at the University of Kansas School of Nursing. And joining me today is Laura Crystal.
Hi all, I'm the fellowship coordinator for the program, and I've been with the School of Nursing for about 3 years now in the Office of Academic Affairs.
And Laura is like the eyes and ears and boots on the ground for our fellowship program. So if you have any questions after today's presentation, don't hesitate to reach out to her, and we'll have contact information at the end. And then also joining us is Summar, and she is one of our clinical postdoc fellows. And so we'll have an opportunity for her to share a little bit about her experience here after we finish with this presentation. So again, this is a one-year fellowship program for advanced practice nurses in primary care. It really focuses on rural and or underserved healthcare spaces, so communities, facilities, that sort of thing. And within the fellowship, there are several different components of it where you have precepted clinics, where as a fellow you build a patient panel, and it ramps up over time with maybe seeing one patient an hour in the first several weeks or months of the program, and then eventually working up to adding more patients throughout the program to the end of the year, seeing a full panel of patients in your schedule. Mentored clinics are similar in that you're still working with the preceptor or mentor, but you are seeing patients with them where they've got a more robust, maybe more complicated schedule, patients with more comorbidities and so forth. And then we have specialty clinic rotations that can really be focused on what the individual fellow has as needs, what they'd like to spend more time in as specialty areas, and what's available in the community. And then a day a week of didactics where we focus on telehealth, we focus on professional issues, focus on clinical issues, and then some quality improvement work as well. This is a sample schedule of what it could look like for one fellow in one clinic, and where you can see that the days are broken up into half days of mentored clinic time, precepted clinic time, specialty rotations, and didactics. And each facility may have a little bit different schedule and how they build it out for the fellow. We like that there's that flexibility in our program that each facility can do what's best for them and the fellow. But we do have Thursdays are our day that are really structured around didactic time, maybe some administrative time for the fellow to catch up on charting and that sort of thing, work on their quality improvement project, some of those different things. These are some examples of some of the different didactic education topics that we've had, and Summar can probably share with us at the end that really we've tried to respond to what the fellows tell us they need. We have an idea of what we think the didactic topics would be, but then as topics have come up, as problems, different types of patients have come up, that sort of thing, we've tried to respond to the fellows and add in sessions that they might want. Telehealth, you saw mentioned there, is a really important component and something that HRSA has really focused on, which is great. They focused on it ahead of the pandemic, but it's been really, really good timing for this program and going forward. So who's eligible for it? Anyone that graduates from a DNP program in a primary care advanced practice specialty between January 1st of 2020 up through May of this year. It could be that a family nurse practitioner. We know that we have one site that's interested in a women's health nurse practitioner. We're really trying to focus the different roles based on what each community needs, what each facility needs. And so as we learn more about what those placements will be, we can give more information. But if you're in a family nurse practitioner program or adult gero primary care, women's health, please definitely apply, because we think those will be some of our needs. And you will obviously, before the start of the program, need to be certified in the advanced practice role and need to have either Kansas or Missouri licensure, possibly both, depending on which site you're selected for. But we'll have more information about that as we know exactly which sites we have available. Laura, do you want to talk a little bit about the application?
Yeah. For the application, we will ask for your diploma or transcripts, depending on if you've graduated yet or if you'll be graduating in May. We'll ask for a CV and then 2 reference letters. We're asking for at least one academic, so like a program director or one of your instructors, and 1 clinical recommendation, so a preceptor or your employer that you've worked with before. There are 6 essay questions that pertain to your interest in working in a rural or underserved area. And then just some details about the application. There's a save and return button at the bottom of the application that allows you to save it and come back at a different time if you don't want to finish it all in one go.
And that application is available on the website. Is that correct, Laura?
Yep. And the link to the website will be at the end of the presentation.
Yeah, and Laura says essay, but I don't want to scare anyone away. They're short essay. It doesn't have to be 5 paragraphs for each question or anything like that. It's just an opportunity for you to tell us a little bit more about yourself and why you'd be a good fit for the program. And then here's our timeline. Laura, you want to explain that as well?
Yeah, so our application is open until March 1st. I also ask that you get your references sent to me by that time, but we're flexible if you do need more time or your references need more time with that. We hope to review all your applications during the month of March, and then get you set up with clinical site interviews during the first couple of weeks of April. At that time, we'll have you rank which sites you're interested in and have the clinical sites rank which applicants they're interested in and do a matching process that way, which has been really successful in the past. And then by May, we hope to have the offer letters go out, and then we'll hand you over to the clinical site to start the hiring process.
Sounds great. So a few details, because I'm sure you're interested in them. The salary for the year of fellowship is $75,000. That includes full-time benefits at the employment site. So you would be hired as an employee of the clinical site, and the salary is provided by them, with some of the portion of the salary coming from the fellowship program. That contract that they would have you sign for that year of fellowship may include an additional year or 2, depending on what the site offers you at the time, but the idea being to retain you in that clinical site if possible. And we do provide a laptop computer for the year of fellowship, since our didactics are done online, and there is tracking. If you've, in your advanced practice program may have used something like Typhon or some other clinical tracking, it's a similar program to that we use for the fellowship as well. So we do provide you that laptop during the year of the program. And then we also work with the Kansas Recruitment and Retention Center, which is part of Rural Health Services. And they also help connect you through the HRSA Job Connector as part of the program. So thinking about what are those recruitment and retention capabilities, possibilities to stay in a rural or underserved area. And then if you have any questions, the website's listed here. But Summar, I think probably what people are interested in hearing about is what your experience has been as a fellow.
Okay, so I am located in Hayes at a clinic here. And when I started the fellowship, I was paired with another nurse practitioner. And it's been great because not only am I in with a pod with her, I'm in a pod with another nurse practitioner, so I can get feedback from both who have probably over 20 plus years of experience as nurse practitioners. But as far as my schedule, I started off just kind of shadowing for the most part to kind of get a feel for the clinic. And then after I kind of learned their system and just the ways of the clinic, they opened up my schedule. And like you said, it started off as 1 patient an hour, just depending on what was going on. With COVID, it kind of changed a few things. So we do a lot of telehealth here as well. So, I could have a couple different telehealth patients within that hour though. But as I got more comfortable and as I was here more, we kind of opened up my schedule to, we took it down to every 40 minutes, to every 20 minutes, just depending on the type of patient that's coming in. So that was great that I was able to kind of build my schedule as the more I got comfortable in this setting. So I do that. If I don't have a patient, I sometimes will go and follow another provider, and I'll like dictate for them and kind of learn just different tricks and different ways of treatments. So that's been great. So I'm always trying to be in a room. So So I do that. And then we have the Thursdays we meet and we, if we have any hard cases or any questions about some of our patients, sometimes we'll just throw that out there, and we have turned it into a whole meeting one time or two. So it's great having, a lot of feedback and a lot of education as you're working. So
I'm guessing it's nice to have like that safe space where you can bounce ideas and not feel like, oh my gosh, I should know this. Other people are judging. Like, as a new provider, sometimes it's nice to have that place to bounce those ideas off of.
Oh, absolutely. And it's only been positive. I mean, I couldn't have asked for a better place. Everybody is so willing to teach and to tell me all their tricks. And
yeah, and you're at an FQHC, which is a federally qualified health center. And so that's like interprofessional in the nature of it, right? Like there's different types of providers and specialty areas and that kind of thing.
Yes. And we have mental health here, we have diabetes educator here. And sometimes when I don't have a patient, like I will go over and talk with them about certain things. And everybody's just been so great about, continuing to help me build on being a provider. So
yeah, and you're working on a quality improvement project. What's the topic of that?
So mine is improving the vaccinations in the clinic, as far as nursing education, talking with patients about different vaccines, and just upping some of our vaccine standards or our levels. So, but it's been a great project. Everybody's just kind of been giving me their feedback, about training wise. So it's not as scary as what you think it's going to be. So
it's not that academic like DNP project, and it was something that the clinic also identified as a need with you, right?
Yes. Yeah, they came at a few different topics. And so we kind of narrowed it down to the vaccine. And then I've just been meeting with them every now and then, kind of just telling what I've done and where I'm going with it. And it's been pretty smooth.
Yeah, that's great. Any advice for people that are interested in applying, or any last thing that you would want to share with them?
So, graduated and just unsure of what to do. I am so happy that I took this. It just gave me a lot more confidence in building my own practice and practicing and having just the extra feedback and just the support from everybody, not only the providers here, but as far as having you guys, KU, and just a wealth of knowledge everybody's been giving us. So it's been great.
Well, I appreciate it, Dr. Anthony. It's always fun to call our fellows doctor as well. So that's really fun. And we're really proud of you. We're really proud of all of our fellows. And this past year, all of the sites have been out in Western Kansas. And we know that we're going to have a couple of sites this coming year in like the urban metro KC area. So it's going to be really interesting, but there's so many similarities in underserved communities, whether it's rural or urban. So we're pretty excited about it. Laura, any last minute things you want to share?
I don't think so.
Okay, well, our contact information is available on the website, and we shared that website with you. And we look forward to whatever questions you might have, and definitely interested in you applying for the program. So thanks.